welcome to the Rundown, everybody, with Dr. Sierra, where we discuss all things running. So this week we are talking about the causes of pain while you're running in your hip, specifically your hip. Because if you are a runner, you know that your hips are heavily engaged while you are running. And if they are in pain, or if they, you've had an injury or something similar or close to that, you know that it really makes it difficult for you to run. So today we're going to talk about some of those reasons why, if you have been feeling it, but you didn't go and get it checked out and you're like, could it be this? Could it be that? I'm going to help you do a little bit of differential diagnosis today, but it is still advised that you go and seek professional help from someone who is able to correctly identify, because I am just giving some suggestions on what it could be, and I don't know everyone's individual medical history or, anything. It's just hard to say how I can help everyone from just giving out some information. So I definitely would suggest you to go and get some medical professional help to figure out really what the root cause of your problem is. So the first cause could be from a muscle strain or from tendonitis. So let's say that you have not been working out for some time, and maybe you have been working out, but maybe you don't properly stretch before you go for your run. And let's say you pull a muscle. So now that muscle's a little bit strained, it's aggravated. That's where that tendonitis comes in, and you could have just aggravated it in some way. And so that when you go to run, those muscles are angry at you because they're already inflamed. So the itis, anytime you see that on any word, that just means that there's some type of inflammation that's going on. And so if you have inflammation in your hip, then it definitely makes it difficult for you to run. I'm sure that you are able to run, but it's going to be uncomfortable because those tissues, the muscles, all of that is aggravated in that area. They're inflamed. So it's just making it more difficult for you to run. So that's just the first reason, or one of the first causes. And so if you are experiencing that, for muscle strain, you definitely want to take some time off from the running so you can allow those muscles to heal. Also, if you have some tendonitis going on in that area, you again want to make sure that you're healing, but I would definitely seek a medical professional, your doctor, so that if it is really bad and it's really bothering you, that they are able to prescribe you something that can calm down that inflammation. It's not something that you're necessarily going to be able to see by just looking at it. So sometimes I don't necessarily suggest, but sometimes it's not something that you can just fix by rest. Sometimes you do need to take something in to go and work internally so you can calm down those muscles and you can get back to your running. And this also depends on how much of a runner you are, how quickly you're trying to return. If it's something that you kind of just do casually and you have time to kind of wait for it to heal, then you can just rest, use ice, but if you need that inflammation to go away a little bit quicker than like just your natural body getting rid of it, then you may need something internally to take to kind of calm everything down quicker. Next is IT band syndrome. And if you are a runner, you may have either heard of it or experienced it before. So you have a tendon that runs from your hip down to your knee. And so when you're running, if you're feeling some aggravation either at your hip or your knee, and it's on the lateral portion of your leg, then it is highly likely that you are experiencing IT band syndrome. Now with that, again, there's some tightness going on in that tendon, which means those muscles are tight as well. So for that, and we've talked about this before on this channel, you are going to need to do an IT band stretch where you are kind of stretching out those lateral muscles. Sometimes people get great benefits from using a foam roller. So if you're experiencing that pain on the lateral portion, you can lay over top of a foam roller and roll out those muscles, kind of loosen them up. But if you are experiencing that pain, you just want to make sure that you're addressing it, that you're properly stretching your lateral muscles before you go out for a run. The only thing that I don't want people to do is just, you feel something, you kind of think something is going on and you ignore it. You have to address these issues in the beginning before they get worse. You don't want to say 6 months down the road, oh, I did kind of feel something, but I ignored it. It probably could have prevented your whole pain that you're having, your whole rehab process. You don't want to make something worse. You don't want a tear to occur. You don't want any of your ligaments to tear. You don't want to have surgery. So if you feel something, even if it's something simple, either take some time off and see if that helps. And if that doesn't help, you want to go and seek help instead of 6 months down the road and you're like, oh, I didn't do anything about it and now I need surgery. That is the last thing that I want anybody to be experiencing is surgery. Yes, you then will have to have rehab. And then, you have to get back into building those muscles, then get back into your running routine. And here on this channel, it's all about running. So I'm pretty sure if you're tuning in, that's not something that you want to do. You don't want to take a break. So listen to the advice I'm giving you, please, and just pay attention to your body before it becomes worse. So next up is trochanteric bursitis. And I know you're probably thinking like, what is that? I've never even heard of that. Well, you have a lot of different bursa in your leg, but specifically in that hip, you have that bursa. That bursa is a sac that is filled with fluid that protects your hip, and all throughout your body where you have those bursa, it protects the bone from being like rubbing on the other bone. It gives you a layer of protection in your hip, especially when you're moving, you're walking a whole lot. And let's just imagine if you didn't have that bursa, it would be rubbing bone on bone, which is very uncomfortable. So you just think of it as like extra cushion to help protect your bones. Now, if people have been experiencing a chronic pain, there's like some inflammation, let's say you had some type of imaging done, and they're telling you that there's like a lot of inflammation there. There's pain when you're walking, there's pain when you're sitting, there's pain if you're laying specifically on that side. You are in a position for a prolonged period of time and you're having that increased pain in your hip. This is one of the things that you may hear come up from your doctor, that you're having some bursitis in that area. Now, again, we talked about a little bit bursitis earlier. If you're having inflammation, if somewhere in your body is irritated because of repetitive action, or it's just maybe you run a lot, or something that you're doing on a consistent basis, those muscles, those bursa, the tendons, all of that becomes very irritated. And because of that, it makes it very difficult for you to be able to walk, to run, go up the steps, come down the steps, maybe sit in your car and driving for long distances. So these are some of the signs that you want to pay attention to. If you're experiencing some of that, pay attention to your daily routine. When does it bother me? When is it hurting me? What alleviates that pain? What makes it feel better? You have to pay attention before it becomes worse. So that's just another one of the things that could possibly be a reason why you're having pain while you're running, is trochanteric bursitis. So you have your femur muscle, and then that is like a ball and socket joint, and it goes into where your pelvis bone is. And so if you look at, there's like a ball on the end of it, and it fits right into there perfectly. However, if it's not the right direction, or let's say like one of the muscles around it that's protecting it is weak, and you're compensating and using that leg a little bit more while you're walking in comparison to the other, maybe some of those muscles have broken down a little bit, and so it's making it harder for you to walk, it's making it harder for you to move. There are a lot of different factors that fall into place when you're talking about the hip, and this is one of the reasons why you really have to address things in the beginning, pay attention to where it's coming from so that you can properly treat it. Because you could tell me you have hip pain, but what does that really mean? We could be doing something that is making it worse for your hip, which is what we don't want to do, which is why you need to make sure that you have a proper diagnosis. So next is a hip pointer. Have you ever even heard of that? Well, in your hip, you obviously your hip and your pelvis, all of that sometimes is used interchangeably. But your iliac crest, which is a part of your pelvic bone. So if you have a really deep bruise that occurs on the edge of that iliac crest, and you can point specifically to that area, and sometimes you can pinpoint it with just one finger exactly where that pain is, that's known as a hip pointer. Now, how does this happen? It typically occurs if, let's say, there's some type of trauma or direct injury to the hip. Let's say maybe it was a car accident, or if you experience where something maybe fell on top of there, or if you fell yourself and you fell directly in that area, and you can pinpoint and say, hey, this is where that pain is. That's typically known as a hip pointer. And so if you are having that pain, if you have that deep bruise, then of course it's going to be very uncomfortable when you go to run because of the movement that you need to do in order to run. So your leg has to go back and forth, which means that those muscles are actively being engaged around the hip and the pelvis. So if this bruise is not going to feel very comfortable for you to run, it's going to really make it very difficult. And if you are able to run, you're probably making it worse. around that area, you don't want to irritate it, you want to rest it. So you would want to incorporate a lot of rest. Maybe you can use some ice so that it can kind of calm down those muscles and the tissues around it, because it's inflamed, it's bruised, it's hurting. And so just think about it. If you had a bruise anywhere else in your body, you're not going to keep aggravating it by touching it or keep moving. You want the blood to flow, yes. However, you also got to let it just heal on its own. That's just what happens with a bruise. There's not a whole lot that you can do. Yes, there are some things, but overall, you just kind of have to wait for those damaged blood vessels to just kind of come back and regenerate so that you won't see that bruise in that area. So similar thing to that hip pointer. So the next reason could be from a labral cartilage tear. Now, if you are unfamiliar with what your labrum is in your hip, we talked about earlier about your hip being a ball and socket joint. And so around that socket, there is a labrum which protects the head of the femur that is like connected into it slides right into where your pelvis is, and around the head of it is a labrum that kind of protects the head of the femur. So you don't want it to be able to come in and out. You don't want your hip obviously dislocating. So that labrum is a protection around the head of the femur, if you will. So it protects it so it's not too much movement. Obviously it moves because how else would you move your leg? But it's so that it prevents from excess movement. Now, if you have a tear in that labrum, there are certain positions, certain movements that will feel uncomfortable. You probably are able to walk without a whole lot of pain, but it's when there is certain movement. Let's say you're sitting down for a long period of time, maybe crossing your legs or lifting your leg in a certain way is going to put that extra pressure around that labrum. So think about if you even try to go running. Yes, you may be able to do it, but it may also be very uncomfortable. And so you would want to make sure you go see a MD so that they are able to do imaging to properly diagnose whether or not you have a labrum tear or not. Now, if you have a labrum tear, obviously depending on the degree or the severity of the tear, then it may indicate that you need to have surgery. So if that is something that you have to do, surgery is not the worst thing in the world. Just know that I have seen people who go and they get that hip surgery, they get their labrum repaired, and with, extensive surgery, they are able to come back and they are able to run again. Obviously, with any surgery, there's going to be some downtime. It means that you are going to have to spend some time in rehab, strengthening your muscles, because right after surgery, you're not able to walk. So, there's an opportunity for atrophy to set in. There's an opportunity for you to lose some of your muscle strength. So you want to make sure that after that you go to rehab so that you are able to address all of those things that are commonly occur when you have surgery. But just know that it's not the end all be all. But if you do have a labrum tear, or if you feel like, when you cross your legs or you lift your leg in a certain position, you're having pain, and if it's consistent, then you definitely want to go get some imaging done to make sure that that is or is not the case. You want to be able to rule it out either way. So the next one I'm going to talk about is osteoarthritis. Now, obviously, the older that you get, more people are definitely prone to having some form of arthritis, especially osteoarthritis in their body. And so because of this, you may feel some aches and pains when you wake up in the morning. You may feel aches and pains if you stand for prolonged periods of time, or if you're sitting for a long period of time. It's just something that can happen over time as you're getting older, and it's your body's way of telling you that, hey, we may be used to be able to do this. We may have used to be able to run 5 miles before, and now we're just getting a little bit older and we're not able to do it. So now with osteoarthritis, it's similar to like if you have a tear in your body. There's not much to reverse that. It's something that you have to kind of learn how to navigate around. So if you are experiencing a lot of osteoarthritis when you wake up in the morning, your joints are very loose, that just means that you need to spend some extra time stretching. You need to make sure that you're spending some time recovering, that you're doing you're doing exercises that maybe aren't giving as much of an impact on your body. Maybe you're not able to walk on the cement outside anymore, and you have to make sure you're walking or running on rubber. or maybe you need to incorporate some swimming into your routine where there's not as much stress and pressure on your joints. So there's ways that you can still exercise. Maybe it's not the way that you've been used to exercising, but that doesn't mean that exercise is ruled out. It just means you have to get a little bit more creative so that you can still move your body, because that is still important no matter what your age is. You need to keep moving. You need to keep your blood flowing. So just get creative if that's something that you're experiencing and you're trying to figure out, how do I get around there? I still want to run in the water. They have they have underwater treadmills. You can walk in the treadmill. You can go in the deep end and you can run. Obviously, it's not the same as what you used to do, but maybe you just need to spend some time doing some water aerobics, doing some water aquatics, something that you can offload or offset that pressure that's on your joints, just until you are a little bit stronger, maybe to get back. So the last one that I'm going to talk about is a bone fracture. Now, obviously in the hip, it may not seem like the first thing that you may think, oh, I'm having pain, oh, I have a fracture there, but you have to just think about the anatomy. So you have your pelvic bones, you have your femur, which is, they connect. And so let's say maybe you have experienced some trauma. Maybe you fell off of something, you were in a car accident, something hit you right there in that area. There are a lot of different ways that you can kind of break your bones. So if you had something maybe several years before and you never really addressed it, maybe you are just kind of still dealing with something that maybe didn't heal properly. It could be that in that area, maybe you have some loose bodies, that maybe there was a broken bone and some of the loose bodies kind of came off, and maybe they're in that hip joint. And so maybe they're grinding on each other when you're running. A lot of different varying factors. That's why it's so important to make sure that you go to your doctor so that they can refer you, so that you can get some type of imaging done. So we can obviously, a physical therapist can look at your body. We can run you through a variety of tests, and whether they come back positive or negative, it can kind of help direct us in the right direction. However, let's say we've been trying a certain exercise or a certain routine for several weeks and we're not getting any results, then this is where we will refer you back to your MD so that they're able to do some imaging, so that we can pinpoint exactly what we're working on, so that we have a better or clear idea of what's going on, versus it's just like, I have this pain here. Okay, but we can't see into your body, so it's really hard to make that firm diagnosis on this is what it is. But if we have more information, it can better help to guide your treatment program, and then we can better help you. So if you feel like maybe you have any of those things that I talked about earlier throughout this video, and it's something that you have been dealing with for a while, maybe you have tried therapy already and it didn't help, make sure that you go see your doctor, your medical doctor, your primary physician, whatever it is, that you can have some imaging so that you can get back to what we all are here for, and that is running. So some of the takeaway points that I just want to kind of leave you with is that your hips are used on a daily basis, and the pain can be in many different places. It can be in the front, it can be on the side, and it can be in the back. So one of the main things that I want you to make sure that you are aware of is, one, the position that you're sitting or even sleeping in. You have to think that, especially when you're sleeping, you're in that position for a long period of time. If you are already a person who is dealing with hip pain, then maybe laying and compressing your hip for, let's say, 6 to 8 hours may not be the smartest idea. So you may want to change your position there. Walking, if you notice that you always have pain when you're going up and down the stairs, then you definitely want to be incorporating some additional strength training, because you could be suffering from some muscle weakness or maybe even muscle imbalance that you're experiencing when you're walking up and down the stairs. Now, also, I just want to leave this with you, that it may not always be coming from your hip, although that's where you have the pain. It could be some referred pain. You could be experiencing pain that is coming from the biomechanics in your knee not being correct. Like when you're running, maybe you're putting extra stress there. So I always like to think of it as a chain. If you have had pain in your hip, knee, or ankle, it's all a chain. And if those are not aligned correctly, then it definitely makes it more difficult when it comes time for walking and or running. And so if you do not address those issues, then it definitely makes it a lot harder when you go to run, and then later on you experience more pain because the alignment is off, the biomechanics are all wrong when you go to run. So you just want to make sure that you're addressing any issue that you feel like, whether it's your ankle and you're like, that shouldn't bother me when I go to run. It may, if it is something severe enough to throw off your biomechanics or your alignment in your leg. So just some things to definitely think about. It may not always be coming from your hip, even though you may feel it there. And let's not forget about your core and your low back. If you've been experiencing low back pain, it could be referring to your hip. If you have a really weak core, then those muscles that are in the front of your hip are having to work a lot harder so that you can stabilize your core to keep your body upright. So it all works together, which is why I always say, if you feel something, go get checked out. You never know what it could be coming from, but you don't want to assume that you think you know what is going on. Let the medical professionals tell you what it is. Let them give you their best educated answer, and then go from there. Well, it was a lot of information in this week's video, but I hope that you all enjoyed it. I hope that you learned something new. If you definitely have any questions, please leave them below. Any comments, anything that is regarding the hip when it comes to reasons why you may have pain while you're running, just leave it down below and I'll be happy to answer it. And I hope that you like this video, you subscribe to my channel so that you don't miss any of our upcoming videos. So we'll see you next time on the Rundown with Dr. Sierra, where we discuss all things running. Happy running!